Hey guys, week 2, day 3. I gotta tell you kind of a funny little story. I watched Tiger King. So now every time I push the record button, I kind of have to fight myself because I want to say, hey, all you cool cats and kittens out there. But I won't do it. I won't do it. I might do it. Anyway, we're ready for this today's reading passage. It's called Twist and Shout by Stephen Fraser. Preventing dreaded knee injuries in young athletes. Anne Montalto was playing in a preseason soccer game in July of 2009 when it happened. She had run down the side of the field, moving into position to receive the ball from a midfielder. Coming to a stop, she planted her left foot and turned her body to get the ball. Ow! A sharp pain shot through her left knee and she fell to the ground. After the injury, I just followed the trainer's instructions, icing and elevating my leg, says Anna. My emotional reaction was that I just wanted to get back on the field. When my leg felt better, I tried to play again, but the pain came back. Anna's physician sent Anne for a magnetic resonance imaging, which is an MRI test. The images revealed a torn ligament in her left knee. A ligament is a strip of fibrous tissue that crosses a joint, connecting two bones. When the torn knee ligament was confirmed by the MRI, I was very, very sad, she says. I knew that I would miss my whole freshman high school soccer season. The injury Anne experienced isn't unusual for young female athletes. It is something they dread, though, often requiring surgery and a lengthy recovery period. It's also something that medical researchers are studying in an effort to prevent so many girls from suffering. Muscle development. Any sport that involves pivoting, jumping, sudden stops, or quick changes in direction increases the risk of harm to the ligament that Anne injured. The ligament is called the anterior cruciate ligament, or the ACL. It's one of 4 major ligaments that hold the knee joint together, connecting the femur or the thigh bone to the tibia, which is the shin bone. An estimated 90,000 high school and college athletes in the United States suffer ACL injuries every year. Female athletes are particularly vulnerable to ACL injuries, says Timothy Hewitt, a professor of sports medicine at The Ohio State University. Hewitt examined hours of videos of athletes in action to learn how ACL injuries happen. What he discovered is that an imbalance in the way that boys and girls use their muscles. During puberty, boys experience a greater increase in muscular strength than girls do. When boys play certain sports, they tend to rely on the muscles at the back of their buttocks and legs and to flex their knees when they jump. But because girls' muscles aren't as strong as boys' muscles, they rely more on the muscles at the front of their legs and tend to land with their legs straight. This puts additional stress on the knee joints, says Hewitt. That extra stress can cause the knees to collapse inward, tearing the ACL. Girls are also more susceptible to ACL injuries because they have smaller intercondylar notches, than boys do. Those are spaces within the knee where the ACL and the posterior cruciate ligament, the PCL, cross. A mildly torn ACL may heal by itself, but a major tear requires surgery. The injured ACL is replaced with a tendon taken from the patient's body or from a cadaver. Cadaver is a dead body. A tendon is a band of tissue that connects a muscle to a bone. Torn ligaments cannot be replaced with a patient's own ligaments because they're all crucial in their various locations. Anne was in surgery for only 2 hours, and she was able to return home the same day. Her recovery period was much longer, though, 6 months of physical therapy to restore strength and stability. Strengthening program. Hewitt has used his data to design an exercise program to prevent ACL injuries. Anne wasn't aware of Hewitt's program before she injured herself, but she learned about it during her recovery. The program, she says, focused on strengthening her quadriceps, hamstrings, and core muscles. The quadriceps are 4 large muscles at the front of the thigh. The hamstrings are 3 muscles at the back of the thigh. And the core muscles are in the area of the belly and the mid and lower back. I also worked on balance, jumping, and landing softly, and making sure my body was in the right position, says Anne. I continue to use those exercises as part of my warm-up for soccer training and soccer games. I have incorporated the exercises into my routine, so it doesn't feel like I'm doing extra exercises. I just know I'm doing really good exercises. For people who don't have access to his exercise regime, Hewitt recommended a properly supervised program of plyometrics. Plyometrics are high-intensity exercises that involve jumping and bounding movements. Jumping on and off a box can also help, he says. Some experts claim that playing sports all year increases the odds of ACL injuries. Not so, says Hewitt. Nor does alternating the sport an athlete plays during a year help prevent ACL injuries, he adds. Anne, now 16, is playing soccer again year-round. Her schedule is rigorous, training 4 to 5 days and playing 1 or 2 games a week. I feel great and have had no decrease in performance, she says. In fact, I may be in better condition due to the great training and instruction that I received. Knee brace. 4 major ligaments support the knee, the body's largest joint, restraining movement between the upper and lower bones. So if you look in the little diagram that they've got right here, which is on page 208, it shows the anterior cruciate ligament, the ACL, and that keeps the shin bone from sliding forward onto the thigh bone. And then they've got the medial collateral ligament, the MCL, which stabilizes stress from side to side. Then they've got the posterior cruciate ligament, the PCL, which keeps the shin bone from moving backwards on the thigh bone. And then they've got the lateral collateral ligament, the LCL, which stabilizes stress from side to side. Then underneath you can see there's the meniscus, and that acts as padding that absorbs shock. So it's kind of a breakdown of your knee. Alright, so that's it for our reading passage this week. Alright, see you next for vocabulary.